HIPAA Fundamentals for Home Healthcare Providers, presented by ICAT Professional Services. Welcome to the YouTube channel of Role-Based Training, a signature program of ICAT Professional Services. Role-Based Training is a program that prepares employees for a strategically important role in an organization by providing relevant mindset, skills, and knowledge to perform the role. In this video series, we break down the basics of HIPAA and briefly answer the following questions. What is HIPAA? What information does HIPAA protect? Who has to follow HIPAA? Why HIPAA matters, and how HIPAA compliance works. Let's get into it. In home health care, trust is everything. Families open their homes and their lives to you during some of their most vulnerable moments. But when it comes to protecting private health information, trust isn't enough. That's where HIPAA steps in. HIPAA stands for the Health Insurance Portability and Accountability Act of 1996. This landmark legislation was enacted to address the growing concerns about the privacy and security of health information in the digital age. It's a federal law designed to protect sensitive health information from being shared without a patient's knowledge or consent. This means that healthcare providers, insurance companies, and other entities must take significant steps to ensure that your medical records are kept confidential and secure. HIPAA isn't just about keeping secrets. It's about making sure the right people have access to the right information at the right time. For instance, your doctor needs access to your medical history to provide the best care, but your employer does not. HIPAA sets the standards for who can view and receive your health information, ensuring that your privacy is respected while still allowing for the necessary flow of information to provide quality health care. Who regulates HIPAA? HIPAA is regulated by the U.S. Department of Health and Human Services. What kind of information does HIPAA protect? HIPAA protects what's called Protected Health Information, or PHI. PHI includes any identifiable information about a person's health, care, or payment for services, whether written, spoken, or digital. Things like medical records, insurance claims, conversations between caregivers and patients, even emails and texts about someone's health, are all protected under HIPAA. Why HIPAA matters for home healthcare providers. For home healthcare providers, protecting patient information builds trust, strengthens your reputation, and ensures you're delivering the best care possible. To stay compliant, it's important to know the 5 core rules of HIPAA. These rules are designed to protect patient information and ensure that healthcare providers handle data responsibly. Understanding these rules is crucial for anyone working in the healthcare industry. First, the privacy rule. It controls how PHI, or protected health information, can be used and shared. This rule ensures that patient information is kept confidential and only shared with those who have a legitimate need to know. It covers all forms of PHI, whether electronic, written, or oral. Second, the security rule. It requires administrative, physical, and technical safeguards for electronic health data. This means that healthcare providers must implement measures like encryption, secure passwords, and regular security audits to protect electronic PHI from unauthorized access and breaches. Third, the breach notification rule. If PHI is compromised, you must notify affected individuals, and in some cases, the media and the government. This rule ensures that patients are informed if their information has been exposed, allowing them to take necessary steps to protect themselves. Fourth, the enforcement rule. It spells out the penalties for non-compliance. This rule gives the Department of Health and Human Services the authority to investigate complaints. And fifth, the omnibus rule. It extends HIPAA obligations to business associates and strengthens patients' rights. This rule ensures that any third parties who handle PHI on behalf of a healthcare provider are also held to the same standards of privacy and security. It also enhances patients' rights by giving them more control over their health information, such as the right to request restrictions on certain uses and disclosures. Staying HIPAA compliant. In-home healthcare. Unlike hospitals, home healthcare providers work in less controlled environments. This means that the usual safeguards and protocols that are standard in a hospital setting may not be as easily implemented in a patient's home. The variability of home environments introduces unique challenges that require a heightened level of awareness and adaptability from healthcare providers. That means you need extra vigilance to stay compliant. Every home visit is different, and the potential for breaches in patient privacy can be higher. It's crucial to be constantly aware of your surroundings and the specific risks they may pose. Here's how. Number 1. Conduct regular risk assessments. Identify potential vulnerabilities in each patient's home and develop strategies to mitigate these risks. Regularly review and update these assessments. Number 2. Create clear policies and procedures. These should cover all aspects of patient care, from data handling to communication protocols. Make sure these policies are easily accessible and regularly updated. Number 3. Train every employee. Regular training ensures everyone is up to date with the latest HIPAA regulations. Include refreshers and updates on any new regulations. Number 4. Use secure communication methods, not personal texts or emails. Encrypted messaging apps and secure communication tools are essential. Train staff on how to use these tools properly. Number 5. Sign business associate agreements with any third parties who handle PHI. These agreements should outline responsibilities and include provisions for safeguarding patient information. And number 6, document everything: training, assessments, incident reports, and more. Proper documentation is crucial for accountability and compliance. Ensure all documentation is stored securely. Number 7, handle patient records with care. Ensure they are stored securely and only accessible to authorized personnel. Use secure storage solutions and access controls. Number 8, conduct regular audits to identify and address any compliance gaps. Use the findings to make necessary improvements and ensure your organization remains compliant with HIPAA regulations. Common pitfalls to avoid. Many agencies get tripped up by simple mistakes, like using personal smartphones for patient information, leaving paperwork or laptops unsecured, failing to report minor breaches, or not training part-time workers. Don't let these errors put your agency and your patients at risk. In conclusion, HIPAA compliance isn't just about following rules. It's about safeguarding the dignity and trust of every patient you care for. By prioritizing education, secure technology, and proactive planning, your agency can create a culture of compliance that protects both your patients and your business. Thanks for watching. If you found this helpful, please subscribe to our YouTube channel. If your organization needs more role-based training or for more information about your training needs, please contact ICAT at info@icat.net. To support ICAT professional services, click the link or scan the QR code on the screen.